Howdy, everyone. My name is Ramon Zarate, and I'm an air quality program specialist with Air Central Texas. For those of you not aware, Air Central Texas is the air quality program for the Capital Area Council of Governments, or CAPCOG for short. With high ozone in our region reaching non-compliant levels, we wanted to reach out to a local health expert to discuss air quality and our health. Today, I'm joined by Dr. Neha Reshamwala. Dr. Neha has been practicing medicine as an allergist and immunologist in Austin since 2012. She moved to Austin after completing her fellowship in allergy and immunology from Stanford University, and she's also a board-certified allergist treating both adults and children. In addition to her fellowship and board certification in allergy and immunology, she has a master's degree in immunology and worked as an immunology researcher at Harvard University's Massachusetts General Hospital. Dr. Neha, thank you for joining me today.
Thank you so much for having me. I appreciate it.
So my first question I had for you, how do air pollutants affect people's allergies and immune systems?
Well, we know that research to date actually has and does show a causative relationship between air pollution, allergies, asthma, and the immune system. And as we know, air pollution consists of different types of chemicals and things of that nature, like the ozone, which is a gas, sulfur dioxide, nitrogen dioxide, particulate matter, along with a number of other chemicals. Along it also to keep in mind, as actually airborne allergens are also a part of air pollution. And really what's really important is that the understanding behind air pollution can directly affect our immune systems, and it does so by actually triggering some different pathways in our bodies and inflammation pathways. And it does this by activating certain cells and signals in the body that cause inflammation to start increasing. And what happens is when this inflammation increases, we start developing the symptoms, such as things that affect our respiratory symptoms, like irritation of the throat, coughing. Sometimes people who have asthma get exacerbations like shortness of breath, chest tightness, can get wheezing symptoms. People with allergies are more prone to also getting flare ups from air pollution, such as having, stuffy, runny noses, having congestion, sinus pain and pressure, eye irritation, itchiness of the skin, things of that nature.
Is there a specific irritant or pollutant that specifically you kind of highlight a lot, or that you deal with, that you can kind of recognize and say that's a big issue in this area, or is it just kind of general? There's just so many things.
Well, I would say for right now, from my understanding, is the biggest air pollutants for us are the ozone, which is a gas, and also airborne allergens. As we know, in the Central Texas area, allergens are very, very common and can be very high for people and do affect the air quality directly. And so I feel like those two pieces, along with a number of other air pollution chemicals and other things that make up air pollution, definitely together collectively make a, I guess you can say, an impact on people's symptoms and how well their health and their safety is.
Which my second question for you was, what are your top concerns regarding air quality and health in the region?
Okay, so for me, when I think of top concerns, as Central Texas grows with an increase in the population, there is a need to monitor air quality and monitor it closely, because what happens is this increase in the population is known to increase the air pollution, and it does that by the increase in the amount of traffic and motor vehicles in the area, new industries coming into the area, emissions from cars. Also, inclusive of that are household devices that release emissions and chemicals that make the air polluted indoors and outdoors. The other things that I feel like also is that, really this has a direct impact actually on the health of the people in the region, and increases their respiratory symptoms in an acute and chronic way, along with causing other allergic asthma flare of their symptoms too, because of this increase in air pollution and a decrease in air quality. And
Oh,
then
awesome.
the other top concern for me also has been, and I think we can all relate to this, is that there's been an increase in the hot weather
Mhm.
And this past summer actually has been very telling about the number of days that we've had over 100 degrees. And there is actually a correlation between air pollutants and chemicals in the air that can cross react with the sunlight. And what it does is by cross reacting with the sunlight, it causes an increase in something called the ground level ozone layer. And this ozone, which is a gas, actually causes an effect on the air quality and worsening the air quality, which then affects us on a regular basis in the sense that it can affect of our health and how well actually we're able to breathe during those hot summer days.
Why is it important that the region protect its air quality?
Okay, well, I think that it's very important that the region protect its air quality, and that's because how it affects the people's health in different ways. For people with asthma and allergies, it can cause an immediate flare up of their symptoms through exposures, like we talked about with their symptoms, and also an increase in asthma attacks for patients that are already prone to having inflammation from asthma. It can lead to more respiratory symptoms for these patients, for these people. And also, the other thing is really keeping in mind is that for others, there is also long-term repercussions of being exposed to poor air quality. And really, it can, really, which was eye opening for me, it can lead to cardiovascular events such as heart disease and stroke, also chronic and respiratory symptoms in our patients and people. And also, it really, kind of behooves us to really make sure that we're really working on protecting our air quality because it really does affect the safety of the community. I think it's important to educate the community and the people of Central Texas, especially in that what really is air pollution, where does air pollution come from, and how it does actually affect our health.
Um, What do the populations look like for you to where like I guess like rates of asthma in this area, even if it's just the Austin area, if you're familiar with that, like how maybe what percentage of the population is actually affected by like asthma?
Well, I can say that from what I know and what I've observed clinically in my own practice, and I'd say about in on the Austin or Central Texas area, approximately at least about 10% to 15% of people actually have some sort of respiratory issues, whether it be asthma or CPD or a combination of those two things.
What demographics or age groups are are more affected by asthma and
What's interesting is that honestly, I feel like it affects all age groups. I mean, I see anywhere from children all the way to adults to our older population actually have asthma and asthma symptoms on a regular basis in my practice. So it's really widespread. It's not just concentrated to even one particular part of the population. And so I think that's why it's really important to, be able to understand air quality and monitor it and take care of our region because it's affecting everybody on some level all across the board. Um, really even in children, the research has shown that actually, air quality actually can actually affect children's lung development and actually can cause children to develop asthma-like symptoms that they did
really?
not have. Yes, and so that's actually some research that's been done that's shown that really again the air quality does have an impact and a significant impact on us.
Do you have any health tips for Central Texans regarding air quality?
Well, yes, there are a number of health tips actually, and a number of things that we as the community can do when in regards to air quality. A couple things that we can do is one is really monitor the pollen forecast and pay attention to our air quality on a more regular basis. And and what's interesting is that we're already almost used to doing that because as this area knows we have a significant amount of allergies, and airborne allergens do play a role in the air quality. So, really kind of encompassing all of the components to what makes up air quality is important, not just the airborne allergens, but the other components too. And I think that by looking at the pollen forecast, it can be really beneficial to us in knowing, exactly what could be affecting us on a day-to-day basis. That's one health tip. Another one is actually also for us, I think it's really relevant, is being aware of on hot temperature days, which we all know have had actually this past summer. That these hot temperature days actually does and can create poor air quality because of that increase in the ozone, an ozone layer that also affects the air pollution levels and can affect our health. And so, being aware that on hot days that, which we have a lot of, that we can be aware that it can be affecting us and affecting our health on those particular days.
Mhm.
Really by knowing that and really looking at the pollen forecast and things, other health tips, of course, are, when it is high pollen days or the air quality is low, knowing that, staying indoors it may be a better option for us. Also considering wearing masks when you go outside when the air quality is low. Certain masks at certain levels actually has been shown to help actually block some of those particles and chemicals actually entering our system and can help us stay safer when we're outdoors. Keeping windows and doors closed on high air pollution days or poor air quality days. Also, using air purifiers in our homes can be very beneficial. Other things to do, of course, is, let's say you go outside, you come back in, changing your clothes and taking a shower can be helpful, especially when you're outdoors and, working outdoors. Also, exercising in the early morning or exercising indoors on high pollutant days actually can be helpful too to prevent flare up of our symptoms. Um, Really, even controlling our allergens, within our home is very helpful, like dust mite covers or encasements for our pillows and such. Also, just
Mhm.
really regularly cleaning our homes makes a big difference in air quality inside our house, and it really can be beneficial to our own health at home. And also other things, of course, are, you know, changing our air filters regularly. Of course, big thing is stop smoking. If you are a smoker, that actually has a very significant impact on air quality inside the house. Other things to do are also consider, when you're cooking, using your exhaust fans. Actually, that is known actually to be really, really beneficial of just turning on the exhaust fan while you're cooking can actually really help disseminate some of those emissions actually from what we're cooking into the air. And it's known actually that cooking can do and does lead to increase in poor air quality inside our homes. Other things that we can do also can be really, being more cognizant of our own behaviors as a community, in the sense of, maybe filling our gas more early in the morning or later in the evenings, actually, so that when it's again very hot outside and filling gas, actually, we know that those emissions can be higher during that time. Um, really participating in, again, how often we drive, or maybe those peak times of driving, changing our driving habits a little bit can be also beneficial, especially as the population in Texas grows.